Hello and welcome to the Royal Cornwall Hospital. I'd like to introduce our experience with the True NTH project, which is the supported self-management project that we're involved with for prostate cancer. We see approximately 400 new prostate cancer diagnoses every year here in the Royal Cornwall Hospital, which has increased year on year, and that's a 25% increase over the last 5 years in the new presentation of prostate cancer that we're dealing with.
When we were looking at instigating this sort of management plan for our prostate cancer patients, we were in a position where we were really struggling because our clinics have just become overwhelmed with the degree of work and follow-up. Many of these patients were also travelling huge distances because Cornwall geographically is a difficult county to manage, and so a lot of my patients were travelling huge distances for follow-up, which would take maybe 5 minutes at the most, and of course that wasn't terribly appropriate. In terms of the sheer numbers of patients, in many ways that's a success story for prostate cancer management, but the fact that we're now treating prostate cancer more successfully means that we now have hugely more patients to follow up.
We see the True NTH project as a way of bridging this gap. It allows well patients to be managed at home. It allows patients to have access to their own records and to follow their own progress. It allows us to keep well patients at home, and rather than bringing them up to wait in a waiting room to find out results that very often they already know. And by having well patients who are on monitoring at home, it frees up space in clinic for patients who are having problems or new patients to be seen in a more timely fashion. We have had a high uptake of patients into the tracker programme. We've had 462 patients who are now on our PSA tracker through True NTH. 232 of those have attended the self-supported management workshop, and 117 are involved in the True NTH research project. I think the positive effects of this type of follow-up are that it gives the patient some control over their follow-up. The patients are involved in an excellent workshop run by our excellent team, where they get signposted as to where they could go if they have issues, or what issues to look out for, so it helps them gain some control over the management of side effects from surgery or radiotherapy, for instance. And it also allows them to track their own health, in that they can see their PSA results, they can see how their urinary function and bladder and bowel function has changed over time.
The PSA tracker is brilliant because it flags up the patients to you that have had their blood tests, and those that haven't had their blood tests that should have done, so we can send them a reminder letter. The way that we used to do things was the patient would either come back to clinic, or they would be followed up on a telephone follow-up clinic, which usually involved between 150 and 170 patients per month. All of those patients would get their PSAs done at different times through the month and wait for a phone call with their result. Sometimes there was problems with this because there might be a delay of between a week and a month between them getting their blood test and having a phone call. And sometimes when we did phone, the patient wasn't in. So this system of being able to either check their own PSA online, or for those that have opted not to check it online but to enter into the letters way of communicating, is so much more quicker and effective. We can get through 20 or 30 patients in about less than an hour, so it's so much more useful as far as time management is concerned. We've been doing the programme for just over a year, and we've already seen the numbers of patients on the telephone clinic reducing, which has freed the nurse specialists up to do more developmental work for improving cancer management across the board with urological cancers, but also given us more time to spend with patients that have got more needs with regard to their disease or progressive disease.
The IT portal has been really useful because it means that patients can now go the next day after they have a blood test to go and see their PSA results. They're also able to message us on the systems, message myself and the two clinical nurse specialists, and they're able to access a lot of different information about sort of how to deal with symptoms and things like that. So it's been really positive in that way. From our point of view, it's much quicker to review a PSA now than it was traditionally, either in clinic or on the telephone. We just have to make sure the PSA is okay, make sure it hasn't had a significant rise, and we press OK and it prints out a letter for us. So it's a lot quicker, it's a lot safer because it sort of gives you the parameters to check it by, and it's a lot better for the patient. We follow up the patients quite regularly, normally whatever the consultant recommends. If they've had radiotherapy or surgery, then their PSA will be reviewed every 3 months for the first year. They'll also be sent a health MOT along with their PSA, so whilst we're checking their blood tests, we're also checking their signs and symptoms for recurrence as well. After the first year after treatment, then they get their PSA letters every 6 months, so hopefully that things are a bit more stable then.
When we run the workshops, we usually have about 10 or 12 patients come along to them. Usually the guys are quite apprehensive when they arrive, but we try to make them as welcome as possible, and usually they chat to each other while we're setting up.
At the workshop we talk about lots of different things. We talk about any of the red flag symptoms, really importantly, so any symptoms that come up that they must let us know about. We also talk about how to deal with any of the side effects that they're struggling with now that they've had their treatment, because although the traditional way of following patients up really dealt with their cancer and their PSA level, we found that a lot of their emotional and physical side effects weren't being dealt with, so that's the main aim of the workshop really. And just to make sure that they've got the tools to sort of, recover from treatment and move on now. Most patients are really interested in the workshop. Quite a lot of them find that the sort of 5 and 10 minutes appointments don't answer all of their questions. So most patients are really excited about having an afternoon's workshop to meet other men with the same or similar problem, as well as sort of getting time with myself and a CNS. There are the occasional patient who aren't keen on moving out of clinic. But with sort of my reassurance and the consultant's reassurance, they're normally happy to come.
I think the benefits of the workshops are that many of the men haven't actually spoken to other guys with prostate cancer, so for some of them it's the first time they've actually spoken to other people who've had the same problem or the same treatment, and they find that quite enlightening and quite reassuring as well to know that other people are going through the same problems. Some people will bring up problems that they've not mentioned before in any other setting because they haven't felt comfortable, but they're all quite happy discussing things in the setting that we are in.
As part of the survivorship programme, one of the things, as well as giving a patient the tools they need to go on with their lives once their cancer treatment is finished, is we're supposed to set care plans with them, and as part of the workshop we encourage patients to set themselves goals. Some of those goals might simply be getting back into an activity that they did before their cancer was diagnosed that they're not doing any longer, such as even going on a coastal walk or riding a bike with some friends. So we encourage people to set goals. Sometimes it can be around diet or even the relaxation exercises that we do while we're in the class in the workshop.
I'm Mike Beard, and I was diagnosed with prostate cancer in October 2014. I found the workshop excellent because it told me a lot of things that I was experiencing but wasn't sure about. So yeah, that was a really worthwhile process to do. I think the website is excellent because it's a quick way of getting in touch with the clinicians, and also for your information that can be put on there. And once I have my PSA blood taken for PSA, within a couple of days I can go on the website and find the result. So it's excellent in that respect.
I think our follow-up care of prostate cancer patients is being revolutionised by this programme. I think we're offering a better, safer, more effective follow-up.
I see self-supported management projects like True North as the future of monitoring and surveying patients who've had treatment for prostate cancer. And whilst this is a pilot scheme at the moment, it certainly is something I would see being standard of care over time. That would certainly fit in with supporting the primary care team and the GPs, the patient, and the secondary care team here.